I guess the final area that we were prepared to discuss this morning is the financial situation, and that's primarily fallen to me and our CFO to try and figure out. I've had numerous calls at the federal level and at the state level trying to figure out what kind of funding will come our way. And I know you're aware that the Congress and passed a bill, the president signed a bill putting some $2 trillion, a little more than $2 trillion into a relief act, and one portion of that act, $100 billion of that $2 trillion number, was specifically for hospitals and physicians, I might add, to pay for the additional expenses. All the things you've heard this morning, they're not free, right? So all the additional staff time, the supplies, everything that we're doing costs something. So there's some money there to reimburse hospitals for all these expenses. There's also a portion that was meant to supplement the lost revenue, because you've got every hospital in the nation has suddenly shut down their the services that really pay all the bills. When you look at our hospital, as well as New York Presbyterian or Virginia Mason in Seattle, the way they keep their doors open is through elective surgery and certain other ancillary functions like radiology and lab. Well, we've all but eliminated those. Lab obviously is still working, and we still have radiology for our urgent and emergent patients, but all the elective cases and all the elective radiology procedures are gone. And with that means a lot of cash. And so hospitals throughout the country are facing, in many cases, closure. I just saw a report this morning that said there's 3 or 4 hospitals in Wyoming that are very, very close to having to close their doors. We are not one of them, I might add. But even so, we have limited cash resources, and those quickly fly out the door when you reduce your revenue by 50%. We do believe we'll be getting a cash infusion of some level from that $100 billion. From what I've been told, from what I've researched and read, and I've been doing a lot of that with this particular issue, $30 billion of that should be sent to hospitals next week, from what I understand. And it's a little technical, but they're using a method of how they basically pay for Medicare and Medicaid, and depending on your prior year payment, you'll get some portion of that. And for us, we don't know what that number looks like yet, but it will in no way make up for the amount of money that we're losing right now by maintaining the services without all the additional elective revenue. So that's of real concern for us. That's not a theoretical concern. That's a practical concern of how we navigate these waters financially. We're trying to do the very best for our community. We're trying to maintain our workforce, but at the same time, we're drawing down on our cash reserves. So we're hopeful that the federal government is actually going to do what they say and help hospitals, because if they don't, we will all see a lot of hospitals close their doors, I think, by the end of summer. So it's a very serious financial situation, and one that we are taking every step we can to maintain our workforce, keep our patients safe, and keep our business going.